I'm Connie Selica. This is Intelligence for Your Health, and today our guest is Dr. Dana Cohen. She's a board-certified internist and the co-author of a book about the science of hydration called Quench. So I asked Dr. Cohen to share some of the basics about staying hydrated and why it's so important to our overall health.
All of our bodies, all of our cells require hydration, right? And the way our body works is that we look for homeostasis. We look for balance in our cells. And the only way to do that is our cells being hydrated. The inflow and the outflow of fluid in and out of our cells requires hydration. Detoxification requires hydration. So you can't detoxify. The way our bodies detoxify is through urine, is through breath, is through pooping, is through sweating, and that's it. And all of those require hydration. So, for those reasons alone, but even just from the cellular level, you can't do anything unless you're hydrated.
So besides feeling thirsty, what are some signs that we are not properly hydrated?
That afternoon fatigue is more often mistaken for hunger, and it's really thirst or dehydration. So brain fog, these are things that people don't necessarily think of that they're related to dehydration. Joint pain is something that often not thought about. Constipation, dry skin, all of those other things, dry mouth. And yeah, thirst is not a good indicator of how well you're hydrating. Because also, by the way, we can train ourselves to ignore our thirst, and we all do that. We all want to work harder. We want to, so we can train ourselves to not be thirsty, and our body gets used to that. We also lose our thirst mechanism as we get older, so it's not a great indicator.
Health and happiness go hand in hand. Intelligence for Your Health with Connie Selica.